Lena back again here talking about hip flexibility. Whether you have a labral tear, a cam impingement lesion, a pincer impingement lesion, both of which are called femoral acetabular impingement. Sometimes those can cause the labral tear. Obviously the symptoms of them is why you're coming to me. We want to try conservative modalities. The more we can stretch the capsule, increase the mobility, we decrease the impingement of the bony bump on the femoral side against the pincer bump on the acetabular side. So we want to minimize that by stretching the capsule out. So I'm going to show you a couple quick exercises to do that. Other than that, physical therapy is going to help you to strengthen all the muscles around the pelvis to try and strengthen the hip itself and decrease the rotatory issues associated with the femoral acetabular impingement. So whether it be preoperative or post-op, I want you doing the warrior pose stretch. It's a yoga stretch that stretches out the anterior capsule. So back up a little bit. So you're going to do 3 different positions, and so your foot is going to be put back. You got to make sure your heel is on the ground in the back foot, the knee is going to be straight, and you're going to bring your forward foot forward. You can bend the forward knee. You're then dropping the pelvis down into it, and with my foot externally rotated, it gets the internal part of my capsule. And so you're going to basically force down into it. Eventually you're going to be able to bring your arms up and overhead, and you go into the warrior pose, and you can feel that stretching there. I want you to do it 30 seconds, twice a day, each position, and there are 3 different positions. So once again, the external rotation of the foot causes the internal part of the capsule to stretch. As I go neutral now, sitting down into it again, keeping that knee straight, I feel it stretch right in the center portion. So 30 seconds there, and then as I internally rotate the foot, it gets the external part of the capsule. I'm really stretching it to try and increase the flexibility of that capsule. Now what that does, and I do it morning and night, and what that does, if you have a little cam bump on the femoral side or a pincer bump here, the capsule in between it gets very tight. And because of that, it pinches, it magnifies the bump, and it causes more pinching. If the capsule is a little more flexible, then you can cross underneath it a little bit more and decrease the amount that you pinch it. That is also useful for post-operatively. When you think about, we go and release a portion of the capsule, which is mostly the anterior part of the capsule, and so post-operatively you try and scar that in. Most patients are sitting in a chair or recliner or in bed with a hip in a flexed position. So if the hip's in a flexed position, the capsule forms in a shortened mode. So when you walk with a lurching gait because you don't want to do that extension, but I actually want you to do the extension. I want you, as you're walking, to concentrate on really forcing that hip back every step you do, just to really make sure you get that extension. Because if you don't and it gets too tight, then you end up walking, leaning forward and protecting it. So I think these stretches are very good to do, whether it be preoperative, postoperative, or to try and avoid an operation, to try and improve the flexibility of your capsule and to get your hip healthier.